In this video, we will describe common C. difficile data reporting errors into NHSN. Within the NHSN annual survey, question 3 asks, what is the primary testing method for C. difficile used most often by your facility's laboratory or the outside laboratory where your facility's testing is performed? Some facilities check the box Other and then enter PCR, or another testing method. If you use PCR testing, edit your selection and select Nucleic Acid Amplification Test, NAAT, as this test includes PCR. In addition, according to the Centers for Disease Control and Prevention, toxigenic culture has limited diagnostic value and is not commonly seen as a primary test method for facilities. If you have selected toxigenic culture, verify the testing method with your laboratory and edit as necessary. To make corrections to your NHSN annual survey, select Surveys and Find. Then select the year that you need to edit and click Find. Scroll to the bottom of the page and select Edit. Make applicable changes, scroll down to the bottom of the survey and click Save. When reporting a C. difficile event, you must enter a date the specimen was collected. Verify the C. difficile specimen date when the resident specimen was collected from your facility, not the date of the laboratory report. If you report a C. difficile date of event prior to the date of current admission to the facility, a validation error will occur. If you reported that the resident has been transferred from an acute care facility in the past 4 weeks, an additional question will ask if the resident was on antibiotic therapy for this organism type at the time of transfer to your facility. If you answer yes, verify that the antibiotic was treating a C. difficile infection. If the antibiotic was prescribed for something other than C. difficile, select no. When reporting the number of residents that were admitted on C. difficile treatment, be sure to report only residents who were admitted and/or readmitted and taking antibiotics specifically for their C. difficile infection. Finally, if you did not have any positive C. difficile lab ID events, check the Reports No Events box. If applicable and this box is not checked, your monthly summary data will be marked as incomplete and will generate an alert. The final video of this series will provide an introduction to NHSN analytics.